My name is Bernd Wohlschläger. I'm a family physician, board certified, and also an addiction specialist. I'm practicing addiction medicine on a daily basis, which includes the management of patients who are suffering from tobacco dependence. I am an addict in recovery. I am an ex-smoker. Personally, I wish that 21 years ago I would have had the opportunity to obtain all the services that AHEC nowadays offers. Would have made my life much easier and less suffering. And as a compassionate physician, I want to have my patients trust and support, and suffering definitely doesn't enhance the trust and support. So AHEC has literally a multifold service program that can help physicians to learn more about smoking cessation and help physicians to obtain material that they can provide patients and to refer patients to resources to get more help and support that they need. And literally contribute to saving a life and saving lives. We as physicians can obtain training that is free and training which is associated with CME credits, ORCID CEU credits. If we intervene and can guide a patient with a few brief, short, guided questions that will help a patient with these brief interventions, and that is something that we can learn specifically by attending AHEC courses, by attending smoking cessation programs. So there are codes, there are billing modalities that our time that we in any way spent with the patient can be appropriately rewarded and reimbursed. It is also important to understand that the Quit Smoking Now program includes patient referral forms, and these patient referral forms help us as physicians to refer to resources where we are not feeling comfortable to help the patient to get these services in our offices. We may not have the skill set, we may not have the time, we may not have all the tools available, and we really want to help. So it's the same way I refer to a specialist, and these referral forms are easy ways to utilize the services that are available. It can take multiple attempts until the message sticks, until a patient is able to move forward and moving out of this relapse mode. And that is something that we as physicians maybe should relearn, the compassion and the patience to help our patients to overcome hurdles.
My name is Rebecca Dickerson. I was a smoker for 39 years. I was recommended to the AHEC program. I did the 6-week program. Nobody judged me on why I stopped and started back. And I was a 2-pack plus a day cigarette smoker before I stopped. And I encourage anybody that smoked to call AHEC and come to the class, give it a try. And I've been smoke-free 1 year and 2 days today.
We as physicians have learned to interview a patient almost like a checklist. Prior to takeoff, a pilot runs through a checklist, and when the checklist is finished, the plane takes off. And in many sense, we are running through a checklist because we don't have time. And so they need some help how to constrain this motivational interviewing within the context of the time that they have, and learn simple strategies, simple questioning techniques to go through an interview without having an open end that lasts for an hour. And that is something that we can learn specifically by attending AHEC courses, by attending smoking cessation programs. And in dentistry, you develop a keen sense of understanding for oral health. Even if you're not a dentist, you focused for 2 years just on oral health. So I still make it a point to ask my patient to open their mouth, even if they're coming for something completely different. And often in patients that have a problem with addiction, we are losing patients because relapse is part of the disease. It took me 5 years, at least 5 years, just to overcome these cravings which were triggered by environmental cues, but I was able to maintain sobriety from cigarettes for now 21 years. We can make a difference. One patient, and the next patient, and the next patient can tell another patient, and then hopefully snowballing, and more people can motivating others. Refer your patient and save lives.